Hey guys, this is Dr. Tim from Head to Toe Spine and Sports Therapy. Today we're going to be going over a little bit of a release that we use in the clinic for the hip flexor, okay? Now a little bit of background, a little bit of information on the hip flexor because we do see this tighten up on a lot of people that we have come in. Now it could just be a hip issue itself, right? It could be something from a sports injury, basketball player, soccer player, something like that, where that hip flexor gets really tight, and then that's going to limit a little bit of that hip motion, okay? But we see this as a player in a lot of other conditions as well. Low back pain, because that hip flexor, the psoas portion of the hip flexor, because the hip flexor is the iliopsoas, that psoas portion lies anterior to the lumbar spine. If it's really tight, it can pull, okay? So just a little background on that. We see this with a lot of different types of conditions, so this release that we're going to do here can be very valuable for anybody for various different conditions that they have. Okay, so Dr. Lee right here, he's going to help me out a little bit. He is laying down his back on the table. The first release I'm going to show you here is just for that psoas muscle. Okay, that psoas being as deep as it is, it's a tough muscle to get to on your own, right? It's a really tough one to get to. So we're going to release this in the clinic, and it's a nice way that we do this here, okay? So what I'm going to have Dr. Lee do is I'm going to have him take a nice deep breath in, and then he's going to exhale out. And as he does that, I'm going to follow his breath in, okay? So here at Head to Toe, we are trained to find this psoas muscle, making sure that we're not hitting other stuff at the same time, okay? So now that I've pinned down that psoas muscle, and Dr. Lee could probably tell you that I'm right on it right now, okay? I'm gonna have him go through a little bit of motion with this as well to help me release it, okay? So what he's gonna do is he's gonna slide that leg out. Perfect, and then he's gonna drop that leg off the side of the table and let it hang down there for a little bit, okay? Now we're getting that muscle under stretch, okay? After a little bit of time, he's gonna bring that leg back up onto the table and in, okay? Go and do one more for me here, Dr. Lee. Perfect. Great, and I'm sure even he could tell you even by the second one going through this, that muscle's starting to release a little bit and it's starting to feel a little bit better. Okay, go ahead and bring that leg back up on there. Alrighty, so as I said before, hip flexor release, really valuable release that we can do in the clinic to help out with various conditions such as hip pain, low back pain, even taking deep breaths in throughout sport or anything like that, because that psoas does tie into the diaphragm as well, okay? So as I said before, if you're having any pain like this and you need a release done and you're feeling like, maybe this is a little bit of an issue for me, go ahead and give a call into the clinic and we'll see you in here.